I'm Vivian C. Turn. I'll be doing the skills video insertion of Foley catheter. My supplies are a trash bag, a pair of gloves, 2 washcloths, and my Foley catheter kit. I'm wearing my uniform. I have my badge. I am not wearing any jewelry, no nail polish, no acrylic nails. Before I see my patient, I will check the physician's order to ensure that I have the correct catheter size for the patient. And then I'll take my materials, go to my patient's door, knock, enter the room, close my patient's door, close my patient's curtain to ensure patient privacy. I'll then put my materials down on a flat, dry, clean surface. And then I'll perform hand hygiene and introduce myself to my patient. Hi, my name is Vivian. I'll be your nurse today. Can you have your full name and date of birth? I'll check their wristband to ensure 2 patient verification. They are the correct patient, so I will explain to the patient what the procedure will be for today. Ms. Smith, the physician has ordered that we do a Foley catheter insertion. What that means is that we're going to put a tube into your bladder so that there can be a continuous drainage of urine because you've been having urinary problems. Is that okay? Great. So the first thing we're going to do is put this trash bag next to you. And then I'm actually going to take off my badge and let you see my ID just so we don't break sterility later on. I'm going to perform hand hygiene again, and then I'm going to don these gloves. So the first thing we actually have to do, Ms. Smith, is get you in the correct position for a Foley catheter insertion. So bed down flat, great. And then you're going to bend your knees and you're going to spread them outward, great. And then I'm gonna raise the bed to the perfect working height for me. The next thing we're gonna do, well, next thing I will do is clean your, the next thing we're going to do is clean your vaginal area with this washcloth. This washcloth is a no rinse soap and water washcloth, meaning that I don't have to rinse with water afterwards. Is it okay if I clean you? So I'm gonna lift. Let's press here. All right, and I'm gonna clean the labia that's farthest from me, top to bottom. And then I'm gonna go to a different area on the washcloth, clean the labia closest to me, top to bottom. And then I'm going to get a different area, clean the meatus, top to bottom, right down the middle, or you could say anterior, posterior. I'm going to pat you down top to bottom, discard, making sure there's no discoloration, discharge, or odor. None are present. And I do see the urinary meatus, so we're going to take off these gloves. Great. Only inside, perfect. Okay, and then I'm going to perform hand hygiene again. I'm going to explain to Ms. Smith. Ms. Smith, I'm going to perform a sterile procedure, so it is important that you do not touch any of my equipment. I don't need a trash bag, I already have a trash bag, so I'm going to throw this away. Nice. So 2 fingers, outside, outside, one at a time, outside, outside. Last one is towards me. I'm going to reposition this. Okay. Outside. Okay. 2 fingers, grab the gloves, put them down, like so. Like so. Take it a little bit away from there. Let's touch. 1 inch margin. Perfect. 2 fingers. Right, 2 fingers. Now we're going to shimmy our way in. Perfect. Only touching the inside. And then we're going to take this hand, 4 fingers, underneath the cuff. Not over the sterile area. All right, nice. So take this, throw it away. Then we're gonna take this, I'm gonna reposition it over here to allow enough space to drape. Okay, Miss Smith, this has to go underneath your waist. So if you could just lift your hips for me. Okay, thank you. Shiny side is down. And then I have to drape your perineum for your safety. There you go. Nice. Now I'm going to reposition these. Let's go over here. Let's go right here. Okay. Only touching the inside of my glove. Right here. Only touching my palm. Alright. So I will put lube. Nice. Toss that. Open this packet. Toss that. Take out my alcohol swab sticks, toss that, making sure that I do not touch the trash. I'm then going to hold the catheter. Make sure to take this out so that it does not touch the sterile field. All right, throw this away. And then I'm going to dip this in the lube. Great. I'm going to take the syringe, pop it off, throw the top away. Okay. Plug this in. Perfect. Now I'm going to explain to Miss Smith. Okay, Miss Smith, the procedure is going to continue. So I have to clean your perineum or your vaginal area again. So you might feel a bit of coldness, okay? So now this hand is considered dirty. So top to bottom, the labia that is farthest from me. Okay, top to bottom, the labia that's closest to me. And then the meatus, top to bottom. Yes. Okay. Now, we're gonna hold the catheter 2 to 3 inches, like close to the end, 2 to 3 inches away from the end. And now I'm gonna explain to Miss Smith what we're supposed to do. Okay, Miss Smith, you're gonna slowly breathe in and breathe out. And when you breathe out, I'm going to insert the catheter, okay? You breathe in and breathe out. Okay, great. Right? I do see urine. I have visual on urine, so when we see urine, you're gonna put it 2 inches deeper. So, all right. Great. And then I'm gonna move my non-dominant hand to grasp the end. I'm gonna insert fluid. All right. All right. And then I'm going to grab this part, take this part off. Okay. And I'm going to take this part, take the bag, move this part. All right. Now we're going to all right. I do feel resistance. That's perfect. Okay. Now that I feel resistance, I'm going to do perineal care. So I'm just wiping you. Okay. And then I'm going to take this. Okay. Down like this. All right. Toss it in the trash. Okay. Ensuring that I don't touch the trash. Okay. So the next step is that we actually have to attach this to your thigh. It's actually going to be in the inside of your thigh. We're going to use something called a stat lock. And the stat lock is kind of like a bandage. That's how it adheres at least. That's kind of how it looks like. But it actually kind of has a lock on it, and the lock will be capturing this part, this bifurcation, and it'll be attached to your inner thigh, okay? So I'm going to do that. I'm going to lift this up and pretend that this is the thigh in this scenario. Okay? And then your bag, undo it. We're going to make sure to hook it to the side of the bed, not the rail, nothing that moves too much. Okay? Nice. Got it. Okay. I'm going to take off my gloves. Okay. From the only touching the inside. And then I'm going to perform hand hygiene. And then I'm going to explain to the patient the direction of care. Okay, Ms. Smith, it is very important that if you want to get out of bed, that you have to call us, use your call light, because it can become a safety hazard if you do leave the bed with your drainage bag. So, it makes sense. Your Foley catheter is supposed to have some slack to it. So if you feel some tension, then you know that there's something wrong, so please call us for that as well. And your bag is supposed to be below your bladder, so it could be working properly. If it is above your bladder, it will not be working properly. So anywhere you go, like if you are in a wheelchair, if you're sitting in a chair, please make sure to have it below your waist, okay, so it can work properly. Do you have any questions, comments, concerns? No? Are you comfortable? You are? Perfect. Okay. I'm going to go document my procedure.